Hi, I'm Dr. Dan Gurman, and I'm going to give you a brief primer on 3D diagnostics using dolphin imaging. If you would like to learn more about imaging, please reference our article in the Journal of Clinical Orthodontics, April 2010. What you're viewing is the template that we developed and published in the 2010 journal. This is the montage of pictures that we use on all of our new patients, and the same montage that we use on our final records. I don't need to spend time reviewing the information contained within the photographs. However, I would like to point out that this is one of our favorite images to study. Teeth separated, with the lips retracted from the soft tissues, and then we're able to evaluate all of the hard tissues as well as the soft tissues to help determine a vertical positioning of the teeth. Now, when we do a consultation and an evaluation using 3D imaging, we start by going over the 3D slices, and the way you get to those is by clicking on the 3D button, and we hit the edit button. That then gives us the ability to view the multitude of images that can be seen with all of the 3D data. We start off by getting an overview of the hard tissues in this view, and as we go around we're looking for any incidental pathology as well as part of our orthodontic assessment. We look at the cervical spine as well as all of the hard tissues that appear in this image. One of the incidental findings that we see in this picture is right here, where there is a calcification in the neck. We see this frequently in our mature patients. Could be a number of different things, including calcifications with the tonsils, and could also be some calcifications within carotid arteries. This is the type of thing that needs to be evaluated by an oral and maxillofacial radiologist or a medical doctor. Going through the pictures, we're looking for pathology associated with the teeth, and in this particular view I notice that there is some radiopacity in the palate, which we'll look at a little bit closer in the other images. In order to look at the slices in 3 dimensions, we click on this box, and it gives us the coronal, sagittal, and axial views as well as the hard tissues. We typically will start by looking at the axial slice, starting from the top of the head by moving the blue line down. It allows me to view the axial slices going from the head down to the neck. We get very good views of the maxillary sinuses, of the airway, and in this view we can see that there is some pathology within the left sinus. We see the roots of the incisors, the crowns of the upper incisors, and now we get into the lower incisors and the lower incisor roots. You get an appreciation for the buccal lingual width of bone, which houses the teeth and serves as the boundary of tooth movement. There are some researchers at Case Western Reserve that are looking at the buccal lingual position of the roots within the axial slice. Stay tuned for more information about that. Again, here we have the airway, and as we go through the palatal slice you begin to see some radiopacity up there, and we'll get a closer look at the radiopacity to see whether or not it's pathologic. We then turn our attention to the coronal slice. To control the coronal slice we move the green line. We'll start at the tip of the nose, and so we're at the nose in the coronal slice, working our way through the upper incisors and back towards the molars. When we look at the molars, I'm evaluating the amount of bone on the buccal and lingual of the upper molars to determine limits of expansion. We're also looking at the angle of the upper molar to see whether it's leaning to the labial or to the lingual, and that helps us determine some ability to expand. As we go through this coronal slice, we get a very good view of the maxillary sinus, showing that there is in fact some pathology within that sinus. Coming back to the potential pathology, I'll line the green bar up with the red bar. And that focuses the image on the potential pathology. We'll now start at the right ear and work our way towards the left ear as we go through the sagittal slices. In the sagittal slice, you get a very good view of the temporomandibular joint right here and the ear. As we come forward, we get good views of the posterior teeth. This is often where we would pick up periapical pathology, chronic inflammation that may be present in previously treated root canals. And we get good views of the incisors within the bone. Now, to make the picture larger, you can either use the scrolling ball on your mouse, or you can click on this view for the sagittal slice. And in this view, you can see how the upper incisor is housed within the bone. If your technician or if you just focus on one of the incisors and do not look at the other teeth, you may miss some important pathology, such as what's going on with this gentleman. When you focus on the right central incisor, you can see that it has a very short root. This is something that you would clearly want to know before you initiate treatment, as it would have a direct impact on your treatment plan. So looking at the static images, if the static image was of the upper left central, the short root would be undetected. So we'll continue going through the sagittal slice. We can see the pathology within the sinus. You now get a view of the left TMJ. You know it's the left side because the red line is on the left side and there's an L. When you're going through the slices, they're pointing in the same direction for the right and left side, so it can be confusing when you save the images. It's not intuitive to know which is the right or the left. Let's go back and look at the potential pathology. We're lining up the line. We're putting the lines on the spot that we think has some pathology. And when we do that, we get a sense of where it's located. We can get rid of the lines by clicking on this bar, this box. We'll make the picture bigger. And in that view, you see a supernumerary in the palate. Another way to find the supernumerary is to look at the hard tissues. And when looking at the hard tissues, you can look from above to see it. And you can actually make a cross-section by clicking on the sagittal clipping icon. We get another view of the tooth right in here. After reviewing all of the 3D images and slices, we then review the static images. Looking at the airway picture, you'll see two measurements. Measurement on the top is the total airway volume, which measures all of the airway. Sarah will demonstrate how to build this picture and you'll understand the boundaries. Just want to be consistent with every patient and every scan that you outline the airway using the same anatomic landmarks. The white line that goes through the airway is determined by the software. It finds the most constricted area of the airway. We look at that measurement to determine whether or not a patient is predisposed to apnea. Although there isn't much in the published literature, our sense is that when the airways are below 50, that a patient has an airway that could strongly predispose them to apnea. When you look at the panoramic image, it looks fairly normal. It looks normal when viewing. With the knowledge that the tooth on the upper right, tooth number 8, has a short root, you might sense that the roots are a little bit short when looking at the pano. You can click on the blue circle in the upper right corner to alter the appearance of the image to try and further diagnose from the panoramic image. In this view, you can get a sense that there is some pathology within the palate, right here. This view also gives a hint as to the short root on tooth number 8. The next picture is the cephalometric image, and orthodontists are very familiar with working with the cephalometric image. You merely need to determine whether you want the typical magnification that shows in 2D imaging to appear in your 3D ceph, and that'll be an option that you can choose when you're setting up your preferences. These are saved views of the temporomandibular joints. These are the sagittal views, the right and the left side. Each of these numbers 1 through 6 corresponds to the slices 1 through 6 shown in this view, so that you know that this is going from the lateral to the medial. We also save pictures from the front, or coronal in CAT scan nomenclature, to get a view of the integrity of the condyles from the frontal view. Our sagittal view that we save is oftentimes the one that highlights pathology, if there is any, on the incisors, and so we saved the view of tooth number 8 so that we could appreciate the short root whenever we review the patient records. A frontal view of the hard tissues. This gives us a very good appreciation of the mandibular asymmetry in his case. Also shows us the calcification in his neck. The more traditional view from the front is being displayed without any measurements. There are a multitude of different analyses that can be integrated into your study. We save a coronal picture showing us the position of the molars within the bone, the inclination of the molars, and how much bone we have to work with on the buccal and lingual. And we also save the axial view. So there you have a primer on working with the 3D images and diagnosing and treatment planning.